Hello and welcome to the respiratory system review. In this lecture, we'll be looking at the differences between asthma, COPD, pneumonia, and pulmonary embolism. So generally, asthma and COPD are chronic conditions, while pneumonia and pulmonary embolism tend to be acute conditions that require treatment, more so pulmonary embolism. So we have 10 differences between the four conditions, and we'll start by looking at the definition and the causes. So in terms of definition, asthma is a chronic inflammatory disorder of the airways that is normally characterized by reversible airflow obstruction, and this obstruction is often triggered by allergens or irritants. Whereas COPD is a group of progressive lung diseases, and these diseases are primarily the chronic bronchitis and emphysema that is characterized by persistent airflow limitation due to chronic inflammation, usually caused by smoking. Okay. Pneumonia, on the other hand, is an infection of the lung parenchyma that normally inflames the airway sacs in one, or it could be both lungs, and it's often caused by bacteria, it could be caused by viruses or fungi. Pulmonary embolism is that the definition of pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs, and it's usually caused by a blood clot that travels from elsewhere in the body to block the pulmonary arteries. In terms of onset and definition, asthma can develop at any age and may vary in severity over time, while COPD typically develops later in life, often after years of smoking, and is progressive in nature. Pneumonia can occur suddenly with symptoms appearing quickly, so duration varies on the cause and the treatment. Pulmonary embolism can occur suddenly and often with rapid and severe symptoms. This normally requires prompt medical attention. When you look at the symptoms of the four conditions, you find that in asthma, we could be having wheezing, shortness of breath, coughing, chest tightness. COPD presents with persistent cough, shortness of breath, wheezing, and chest tightness. In pneumonia could present with some systemic symptoms such as fever, chills. We could also have productive cough, chest pain, and difficult in breathing. Pulmonary embolism is sudden onset of severe chest pain and shortness of breath with rapid heart rate. So those are the differences between the three conditions in terms of the definition and definition and cause, onset and duration, symptoms. So we can look at the underlying mechanisms and the risk factors. So for the underlying mechanisms, asthma is normally caused by airway inflammation. So this inflammation normally leads to bronchoconstriction, narrowing of the bronchial vessels. And this one is normally accompanied with increased mucus production. Whereas chronic obstructive pulmonary diseases, there is chronic inflammation, which normally leads also to damage of air sacs and airways, and we have reduced lung elasticity. Pneumonia, on the other side, there is infection and inflammation of the lung parenchyma, okay, the lung tissue. Pulmonary embolism, this one, it normally results from there's a blood clot that normally obstruct the pulmonary arteries. Okay, so in terms of the risk factors, I think we can be able to appreciate that. Let's look at diagnosis, treatment, and prognosis. So, in terms of treatment, in terms of diagnosis, you find that asthma, we can diagnose this through the lung function tests. We can also take the history of the symptoms, and we can look at the response to the bronchodilators. Okay, whereas on the other side, lung sounds, we have lung sounds, that is spirometry for COPD. We could also do imaging and take also the medical history. Pneumonia, we have chest x-ray. We can do a chest x-ray. We can also do the blood tests and physical examination. Pulmonary embolism, we better use the CT angiography and the D-dimer test just to see the coagulation fragments, and the ultrasound. Okay, thank you so much. So from there we can go to prevention and the complication. Okay, prevention and the complication. On the prevention and the complication, did I look at the could you have the treatment before I go to the yes, let me look at the treatment first. Yes, treatment, guys. So in treatment we are having the inhalers, could have bronchodilators or corticosteroids, and lifestyle management and allergy control for asthma. Whereas COPD, we could have bronchodilators, we could also have inflamed steroids and supplemental oxygen and lifestyle changes. For pneumonia, we have antibiotics if it was caused by bacteria, antiviral for the viral, and we could also have rest and fluids. Also, for pulmonary embolism, we have the blood thinners, we'll use the anticoagulants. We also need oxygen therapy, clot dissolving medications, okay? Clot the thrombolytics. Okay, fine. What about the prognosis? Okay, for the prognosis, you're saying that asthma is generally managed with treatment, but severe attacks can be life-threatening. We have COPD. We have progressive disease with reduced lung function, and there is increased risk of exacerbation and complication. Also for pneumonia, usually treatable with antibiotics, severity may vary. But for pulmonary embolism, severity varies, but requires prompt treatment is essential to prevent complication. So now we can go to the prevention and complication. So on prevention and complications, for asthma, you just need to avoid the triggers, allergens, you manage allergies, and you take the prescribed medication. For COPD, you avoid smoking. Okay, guys, this one I know is very difficult, but we can have some session where we can see the techniques on how to avoid smoking and any irritants, and it also requires early diagnosis and treatment. For pneumonia, we now make sure we have vaccination like the pneumococcal, the flu vaccine. Okay, we also practice good hygiene and avoid sick individuals. For pulmonary embolism, we prevent deep venous thrombosis through movement, being mobile, medication, and compression stocking. Okay, another review of pulmonary embolism is there. You can review it and see the rationale for each intervention. In terms of complications, asthma, severe attacks, we could have severe attacks, okay, status asthmaticus, even respiratory failure. For COPD, we normally have COPD exacerbations. We could also have respiratory infections and heart problems. For pneumonia, we could have respiratory failure, sepsis, lung abscesses. For pulmonary embolism, we could have pulmonary infarction, right heart strain, and even shock. So guys, those are the 10 differences between the 4 conditions. Remember to access the free quiz in the description section of this channel just to test your knowledge and reinforce understanding on the 4 conditions. We also have lectures for the different conditions just to understand the rationale in each case. Thank you so much.